Matt, did I put you like?
Yes, it's me.
How are
Hi,
you?
Leon.
How are you?
I'm I'm good. How are you?
I'm all right. Today is Friday, right?
No, it's been. We're getting ready for our annual grow meeting on Saturday, and we have worked. Me and Kisa, we've been working our little butts off. If you'd like to join us, it's at the library from 1 to 4. If you want to come and say hey,
I may just do that.
well, you sure can. It's at the Champaign County Public Library,
Okay. It's at the which library you say?
the public library, the big one.
Oh, Champaign County.
The
Yeah.
Mm-hmm.
Are you guys ready for it?
I hope we will be by tomorrow morning.
Good deal. Good deal.
5 bucks though. 5 bucks though.
Well, in that case, I'll.
Oh, you didn't get it in the mail?
No, that's fine. I got the clothes.
They'll probably come late. All torn up. It's like in the back of the mailbox or mailbox or whatever. Hey, Elaine.
Leon, can you hear me?
I can hear you very well.
Okay, thanks.
Are you nervous?
No. Mm-mm.
No.
You're only nervous when you don't know what you're talking about.
Oh. What?
Oh boy, I don't know if that's true or not. I get nervous about everything.
Let me speak for me. I don't get nervous when I know what I'm talking about. Now, there's a level of humility that I have. Like, I hope that it's a good presentation, but
You always
nervous,
do good.
but nervous. The only way it's like if someone like says something, hey Josh. Hey there. That's the only way.
Sweet. Going. Good. Awesome.
All of you have a quorum. That's a quorum.
Got one more minute.
Okay, absolutely. Oh, goodness. Am I on?
All right, since we have a quorum, I will call the Champaign County Mental Health Board meeting to order. Can I have a roll call, please?
Absolutely. Matt Hausman,
Here.
Daphne Maurer,
Here.
Molly McClay,
Here.
Elaine Palencia,
Here.
and John Paul Yuaki.
Here.
Oh, sorry. Okay. Lisa Liggins Chambers, Joe Omo Osagie, Jen Straub, Jane Sprandel, and John Paul Yuaki
Yeah.
once again.
Here. All right. So with that, the next item is the approval of the agenda. Oh, we got Joe here. Hey, Joe. You are right there between Daphne and Elaine.
Very long walk.
Um, so I guess we can do a voice vote for the approval of the agenda, or does it have to be?
You can, because you're
Yeah.
in person. I put it on the screen so that the public can see what you all are voting on, but
Yeah.
you don't have to do.
So I have a motion to approve for the agenda?
So moved.
Do I hear?
I will second.
Aye.
Aye. All those opposed, same sign. All right, ayes have it. Oh, we got Jane too. Sweet. All right. So, the next item is, the acronyms and glossary. We can skip over that. And the timeline. Oh, actually, the timeline. I don't know if you want to talk about that. Yep.
The joint meeting that we were to have next week with the DD board can be canceled because we were sort of holding it in case you needed to meet without them next week if we didn't have a quorum. So it's canceled. Okay,
Yes,
yay.
it is canceled.
And then there's a mistake on this schedule, which will be fixed in the November board packet, and it is fixed online. Just that we had scheduled a meeting date on a holiday in 2024, so it's fixed. Okay.
All right, with that, we'll go on to my comments. Obviously, we have a lot to cover today. The one thing I just will talk about is with it being the winter season, and mental health, I think obviously we'll start seeing more of a need for mental health services, usually in the summer and the winter time, just because of less sunlight, more isolation during the holidays, and just watching out for people and family members and friends. Obviously, with things going on in the world, there's also been a rise of hate towards other people, and just urging for kindness and compassion and empathy for everybody. So just wanted to mention those things. Now we'll move on to Lynn's comments.
I think in the spirit of hopeful messages, I should say, I'll keep it really short because you do have a lot to cover tonight. And I actually really like this board packet, so I hope you enjoy what's coming. But there's one thing in this board packet that I didn't celebrate, and I think I should, and that is that we observe an increase in PY 22 from the year before of services to people in Rantoul. And that's a goal that this board has had for a long time. So the programs appear to be reaching more people in Rantoul. So yay. Okay. I know that's small, but that's important. Okay.
All right. Next item is the approval of the mental health board minutes from July 19th, August 16th, and then September 20th as well. So I'll give everyone a minute or two just to look that over.
If there's no discussion, I make a motion to approve the minutes from the July 19th, 2023 Mental Health Board meeting and August 16th of 2023 Mental Health Board and Disabilities Board joint study session, and the 9/20 of 23 Mental Health Board discussion are included for approval.
Do I have a
Okay.
second? Oh, go ahead. Oh. So with that, I thought Elaine,
I did, we kind
sec-
of.
yeah,
both
I think
did.
I blocked out her sound, but yeah. So Elaine second. With that, we can just do a voice vote for that, right? So all those in favor say aye.
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 Sorry, the next item on the agenda is the vendor voice list on pages 29 through 67. Very extensive list, I'm guessing, because we couldn't approve that last time.
I think it piled up for two reasons. But one is that you couldn't approve them last month, but there was also, I think we had a study session in August. So you have, looks like you might have July, August, and September all in here for both. The IDD Special Initiatives Fund is also in there, but they're just 2 checks each month. So.
I saw we had to return some of the unused ARPA funding. Yeah, that's a little painful.
But you know what? The county board was really glad. They were waiting for money so they could reallocate it.
Oh,
so
okay.
you know, our loss is their
Okay,
they will
as long as
reallocate.
it's
Yeah.
still within the county's
Yes.
use, so. Still though, there's a huge need for mental health services, so it would be nice to have been able to use it, but.
That is kind of unfortunately our new normal, that because these are grant contracts, the money goes out, and then if it's not spent, it comes back, you know, at 6 months after the close of that year. So that is a measure of not being able to staff up, not being able to fulfill all the services, but we've gotten used to it. I want it to not be.
I mean, we could staff up more if the state would increase the rates at which our agencies could pay people.
There's some, speaking of which, there were some opportunities to file witness slips today, but I think those were federal workforce development programs. I didn't forward them out to you because we have a lot to do tonight, but I could, if you're interested in weighing in on those to increase the behavioral health workforce. Okay.
All right. If there's no discussion, I will go ahead and move to approve the vendor voice list. Is there a second?
Second.
With that, all those in favor say aye.
Aye.
And those all opposed say aye, same sign. All right, those that approve it have it, so we'll approve the vendor voice list. The next item is the staff reports on pages 68 through 87. Yeah, go ahead. Oh, I missed that part. Sorry. When brought to my attention that I did skip over the citizen input section. So let's go to that. If there's anybody that's attending the board meeting that would like to speak, now's the time. We'll limit public participation to 5 minutes, 20 minutes total for the whole session. If there's anybody, just raise your hand in the audience and we'll call on you to speak. Is there anybody? No.
What I see are a number of agency representatives, so
Okay.
they have another opportunity later
Yeah.
to do input if they're choosing not to right now. So
Okay. So with that, we'll move on to staff reports then. No, thank you for bringing that up. Yeah. Yeah, I just thought it was interesting that Tracy Parsons and Miss Amy Brown are going to be presenting the summer initiative in November next month. Yeah. Mhm. Yeah. That's good though. You're planning ahead, right? But
I think it takes a while to compile all the data, and we asked this year for a little bit more.
mhm.
We asked for sort of the nature of satisfaction surveys, but briefly from the youth participating. That's hard to do when you see those kids for 4 or 5 days and then that's it.
Yeah.
So I don't know what they're going to bring us, but they needed a little more time to prepare it.
Yeah. Were there any questions or comments? All right. With that, we'll move on to new business on page 88. That's the CCMHB 3-year plan with the draft objectives for 2024. I feel like we've gone through this a few times, haven't we? This one.
This is a little bit different.
Mhm.
You've seen the priorities for the next, they're draft versions of priorities for the mental health fund and the IDD Special Initiatives Fund. You'll see those again in November. And you'll see this again in November in a final version, but these are the initial changes that we're recommending. So we might get more input. I believe Leon sent out a request for public input 2 weeks ago, or
2 weeks ago.
and then now we can also receive input from you and make some revisions. We'll bring you all that stuff in November. It's time for reading and revising. It's a season.
Well, the revisions that are in there and the deletions, I think, are very good. I like the direction you've taken. Especially the inclusion of input from different constituencies. I think that's really good. And then I think, why didn't we do that before? Have that in there, but very good.
If you it's helpful to, if you want to go deeply into this, we can send you the Word version of it too, just separate it out from the board packet. But I don't know, like, these are all, you know, if you're interested, jump in and give us feedback. If you're not interested, that's okay too. We're getting feedback. So. Okay.
All right. Are there any other comments or questions? I know it's a lot to read. No, it's good. Of course, you know, if anyone does have questions or comments, we can always email Lynn too, and we can always talk about it at the next meeting as well. All right. With that, I think we'll move on to the PY 2023 agency CLC and related trainings.
This is Chandra's going to present. I just want to, before she starts, I want to apologize because she had a really pretty title on this document, and I just managed to fully obliterate it when I was creating the board packet. So anyway, I think she's here.
Yes, I am here. Hello, everyone. How are you? So this is a summary or a synopsis of all of the trainings that all of the funded agencies have taken over the fiscal year. So one of the requirements of some of the requirements of the CCMHB is to have annual training around cultural competency as a part of their contract requirement. There are some organizations that did just one. There are others that chose to do just different trainings and reported on them on different top subject matters that were surrounding cultural and linguistic competence. What I do want to let you know is that there is the topic in today's current culture that is centered around diversity, equity, and inclusion. While it is not the same as cultural competence, it can be inclusive. Cultural and linguistic competence really does focus on the individual and the culture of the family that is centered. And so we want to make sure that agencies that are serving individuals are really thinking about the culture of the family, whereas diversity, equity, and inclusion kind of looks at overarching values that are in organizations, which is what makes it different and separate from cultural competence. And so CCMHB has chosen to keep cultural competency as a part of things because DEI does not replace cultural competency. What it does is should enhance from an organizational perspective, where we are culturally responsive to the needs of our families and individuals that are served. Whereas DEI looks at ensuring that there's representation and that there are inclusive values and practices and equity shown in the services and supports that are offered. So I just wanted to make sure that I explained that to you. As you can see, a lot of the organizations have definitely reflected their changes in their cultural competency plans. There was an organization that had their same plan for a few years. And I had to sit down with them and we developed new actions based on training that they had received. And so as a part of my role, I am able to provide training and support to the organizations, but I do not dictate the kind of training that they should or should not have. So I do not take each of their training through a vetting process. I take it through a I just make sure that they just complete the requirement. And some mention the names of their training, and then there are others that didn't document it. And so if I have further questions, it's usually comes through and reported through a site visit or a desk review or a phone call that I have with the organization. Next month, I am going to present a report that was just completed about racism in the workplace. And there are findings and actual solutions on how organizations can begin choosing anti-racist practices. And this is probably the largest sample size of its kind that I've ever seen, that did not just do sample size in the United States. They looked at racism from a global perspective, which is why I appreciated that particular report. And so that will be incorporated into my report next month. And I hope that you take the time just to read through. It's a pretty simple read, but it is very informative on how racism is impacting the workplace, because racism just does not exist in the United States. It exists globally. And this is this study that was conducted and this report that was completed gives a really good example of what that looks like played out, and then also solutions. And so this particular report, again, is just a summary and a synopsis of the trainings that all of the funded organizations have submitted over this past fiscal year. And each year we will increase and enhance of what I will report to you all, because I do not give their cultural competency plans to you all. Of course, as board members, you have access to them, but I have not presented all of those because the board packet would be really, really huge. And so that is why I give a synopsis of what activities and services that organizations are providing. Are there any questions from the board?
No, I think, we understand that, it's important for all these agencies to be doing their, CLC. And I think, it's good to know that we're keeping on top of that, but I know not all the agencies are telling us when they're doing are they telling us when they're doing all their training, or if they,
Yes.
Okay.
Yeah, they do report it twice a year. So they report it in their second quarter or their fourth quarter reports.
Are you finding any difficulties in them getting access to the training or finding time to get the training done?
There's a couple of them that do have issues with time. And so it's usually noted, but because of the services that they provide, I do know that they're on a journey. And when I say that they're on a journey, it's usually I look at their reports and it's connected to the services and supports. But also they attend training in the community connected to the people that they're serving. I just don't know if they know that they have to that they can report that. So that's just a conversation that can happen with agencies. It's probably a couple of them that actually just have not been able to do any just because of capacity or just time. But everyone for the most part is in compliance of the board requirement.
Excellent. Well, thank you so much, Chandra.
No problem.
All right. Any other comments or questions?
Oh, I just wanted to add, thank you so much, Chandra, for I'm gesturing to you across the room in this tiny video box. I really appreciated you sharing all of that and putting that together. And I think the point you made about the distinction between CLC and DEI, I think is really important. And what you mentioned about this idea of CLC is really about centering the individuals or families and their culture that, you know, these agencies are particularly serving and our community is serving. And then thinking about DEI as a big picture kind of concepts, I think is really important for us to remember. So I really appreciate you mentioning that.
Yeah, I just want to make a comment. I'm involved in another state with a nonprofit organization that, because of the way it evolved over 100 years, somewhat in isolation, never put in place either cultural competency documents or practices or a diversity statement. And now one of those underrepresented, stigmatized groups has called them out on it, and they have lost funding. People have taken them out of their wills, and it's a terrible shock to this group that just never thought about it. It's hard to imagine, but they never thought about it. And they all agree that they should have thought about it. But it's a very interesting, I mean, it made me feel good about what we do here. And it's going to be very interesting to see how they do the research and how they think about how to make up for this pretty substantial oversight that they never had to think about before because of where they were and who they started out to serve. But so I'm just watching and have offered to give them some of, you know, the statements that we have come across as models of what you can say about, you know, diversity and so on. But it's going to be an interesting process.
And I think it's only going to get, it's going to speed up. You know, like I just look at, you know, like the town I grew up in was 100% white. And there were many who wanted to keep it that way. But, you know, in the last 30 years or whatever, I see how there is some diversity in this small little town I grew up in. And so I could totally see, and it's unfortunate there was more, they omitted something rather than they said, we do not care for these individuals or these people don't, you know, qualify. But gosh, to think to be living in a time you would inadvertently omit something. So I agree. Shonda's great on helping our groups with that.
And Jane, the other piece that we are also speaking of is that while a community may have been 100% white, there was still diversity in those communities, but because it was never highlighted or their culture wasn't centered, these are things that we get to talk about and even bring up because everybody has different needs for mental health services or just to receive services at all, just based on income. And so I encourage people to think about cultural competence and DEI really bigger than just race and ethnicity and gender, because there is diversity present anytime there are more than at least 10 people in the room. I've tried to make sure that I've moved us to that space as well.
And I think the other thing is, it's not just taking that training once and then, oh, I'm going to know this, because it kind of goes against the way our brains are formed. Our brains are pattern recognition, machines that just kind of take all the vast information we have around us and kind of streamline it for us so we can kind of just get through our day. But then when you do that, you overlook a lot of things, you make assumptions about things, you you don't realize you're doing that. And so having that training every year and reminding yourself and looking at what your weak spots are, your blind spots, trying to strengthen those weaknesses so that you are providing a more holistic care to the people you're serving is really important, regardless of what agency or what services you're providing.
And I think, I think a couple of years ago, we talked about the difference, I think Chandra and I, the difference between cultural competency and cultural humility. And the whole idea of cultural humility is that you don't know it all. Competence means that, okay, you've taken a test and you've passed something. But with cultural humility, it's an ongoing understanding of yourself as an individual, understanding what it means to be a part of a larger pool. So it's an ongoing conversation. It's not something that's static, and we just have to keep going on in that direction.
Absolutely. Thank you, Joe. Any other questions or comments?
Well, thank you so much, Chandra.
No problem.
All right. Oh, for the old business or? All right, so for the next item on the agenda, it is the agency request for consideration. Oh, sorry, I misread. Sorry, the PY 2023 utilization summaries and demographic data on page 109 to 124.
So this was my baby. And I want to say thank you to each and every agency that got their quarterly reports in on time so that I could compile all of this terrific data and present it to the board. This basically shows over the year the targets and the actuals. And so just going through this, you will find that I would say about 90%, 95% of the agencies met their targets and if not exceeded their targets. So kudos to the hard work that's been going on with the agencies. This is much a greater improvement from the previous years in terms of getting their reports in on time. So, and I don't know what that's attributed to. So thank you. It just makes my job a lot easier. So yeah, so they should be applauded for their outstanding work.
Quick question, Leon. Do they give any rationale or anything follow up when their targets are quite a bit off, or when their actuals are quite a bit off of their targets?
Great question. So what tends to happen is there's a section in the reports where they can make comments, and in that section is where I'll discover some of the concerns that they're having, the struggles that they're having, and so it's in the report.
The other thing that Leon is working with, that it depends on the information being provided in time, and there were a couple that he had to work with. There are the long reports that they give us at the end of the year about the whole year, and those really focus on the outcomes, the consumer outcomes now. But in those reports, there are often narratives explaining what they think happened. So what we keep running into every year is, by the time we've got them all put into one document and posted, it's 400 pages and really hard to absorb, let alone like pull interesting information from. So he's working on that now, and we have the evaluators. The evaluation capacity building team is going to help us try to improve that system, because they're telling us lots of really good stuff, but we don't have a way to make it smaller to share with you the highlights. So, right, like it's like a technical effort just to put all the reports together into one. I don't know, like I don't know.
Technically fun.
Yeah.
And so this might be a breakout question later or whatever, but like I noticed like Don Moyer Boys and Girls Club, some of their targets are, they're not hitting the targets without having to like go into a doctoral thesis. Is that because they're having a hard time getting enough staff to give these programs or enough youth to take part in the programs?
I think you hit the nail. I think it's a combination of things. I think it's staffing, shortage of staffing. I think, anytime you're engaging youth, that's a challenge in and of itself, getting youth to want to stop what they're doing and participate in a program. So that's a challenge. That's very challenging. Yeah.
Oh, there they are. You'll see both of these documents again in the annual report, which we can't put together until the auditor's office is finished with our 2023 activities. So these will come back in March or April.
I mean, I do like the fact that 29% are Rantoul and other parts of the county, other outside of Champaign-Urbana, which is nice. So I feel like we are reaching, smaller towns and villages in the county, and not just serving the two main cities in the county. I guess the only other thing was, do we have data on first, like the preferred language for families or for people that are service? Because it says Latino, but like they could be all English speaking, and we don't know if we're hitting the Spanish speaking families that are like Guatemalan and Mexican, or like the French speaking Congolese that are African American. They're African, so because those are our major ones that we see, at least in my clinic.
So that is not a data point that we've asked for. So that could be a change in PY25.
I understand that you said that clearly we need a better way to analyze what the agencies are reporting, but were there, from the 30,000-foot overview, any common themes that could be gleaned from those reports, such as?
I haven't been able to read them yet. They were due at the end of August. A couple of them were late. They're multiple pages, and Leon has put them all together into one document that'll be posted online. And then if we're not too deep into the next project, so this is one of the problems that we have, is that by the time we get information, we have to move on to something else. So that would be a dream come true to be able to answer your question, because I know they're putting a lot of thought into these reports, and I know that we would get a lot out of being able to read them. But fingers crossed that that'll be done pretty soon, and I'll be able to look at them.
Thank you.
I mean, I've only been on the board since 2019, but it seems like there isn't a huge miss on targets this year from a lot of, like Leon was saying. And I remember previous years where there was a big miss in a few groups, and they usually would already tell you what their difficulties were. And so it seems like if most of these are hitting or close to their targets or exceeding their targets, that things are hopefully running smoothly with many agencies right now.
But then on the flip side are there things, for example, looking at the Up Center and their numbers were like 3 or 4 times. And so, okay, is there something that we need to address from that standpoint?
Yeah, I mean, I think Molly touched on it probably a meeting or two ago, how there was an increase, an increased need for services for that group just because of things that are going on nationally. Yeah. But yeah, no, it's good to bring it up and address it and kind of make sure that we're not just assuming it, kind of crossing our T's and dotting our I's and making sure that that's what the issue is and not that we're missing something else.
I can say that, like, I don't want to make a lot of the aggregate demographic and residency data because those are duplicated numbers. So you're funding such a big variety of service types that there are going to be screenings in there, which, that's 1 visit or 2 or 3 visits and then done. And that may be on behalf of a person who then gets services from 5 different programs. So they're overrepresented. So I try not to make any big conclusions from those data themselves, but compared to last year, I can compare them with last year. And what's good is more people were served, so the N is bigger, but pretty much this really similar distribution across those categories. So maybe this system's kind of stable, and then better presence in Rantoul, more like I think I said that at the top of the meeting, but I did read all of the DD service outcome reports because those were all done, a while ago. And I learned some really interesting things about the DD system there. So, and there's one that goes into really great detail about the challenges that they were finding between when they asked people what they wanted to work on, which was socializing more, and then what people could actually do. Like they said they needed more friends. They said they needed more time in community activities. But then when it came to now we have some opportunities, they didn't want to do them. So that was interesting. What is that? Like maybe a post-pandemic kind of, we just don't know how. So that was really interesting. There were some observations about much, much greater engagement, especially in support services like for helping to get employment since the height of COVID, like people are ready to get to work and things like that. So those were really interesting comments. I'm really looking forward to hearing what the mental health board funded agencies have to say about last year too. And I'll try to get through them all, but in the past I've gotten like 10 pages in and then we had to work on something else, applications usually. So anyway, thank you.
All right. Any other comments or questions? All right, seeing none, we'll go to the old business. So we have the agency request for consideration on page 125. It's a formal request to waive the automatic cancellation of PY 24 contracts. And then the decision memo offers context and a motion, and then the board action is requested. So, we did talk about this at the last meeting. We didn't have a quorum to put a vote to it. We did want to approve it.
But you wanted to add something to the
Oh.
motion, maybe that was.
I think it was the timing. Oh my goodness.
Like to the end of the year.
What did we say?
Yeah, I think you had talked about it.
It was
an idea, like to give them to the.
I had it on my other one.
Right?
Yeah, we
Well,
didn't want to
no.
just do this again in a month or something like that.
Yeah, so we wanted to make it before the meeting. That was the thing, the timing for the meeting. I think it was December like 12th or 13th or something, because how much time did you need?
Yeah, you're right. It's the case.
Because you have to post it
December 11th.
and send out the packets. Okay.
The packets you don't get.
So what would be the optimum time before the December 20th meeting?
But if they got it to us by December 10th, which is Sunday, that kind of stinks, but then.
Okay. All right.
We also have to read it and
All right.
have our consultant read it, so maybe it should be December 8th.
8th?
Okay.
Okay.
Then there's.
Because how much time did they say they need? I forgot what they said.
November 30th.
November 30th. So I think December 8th would be good then.
Yeah.
Now, will their board have to approve it? So are they gonna be able to get it approved between November 30th and December
I
8th?
forgot, when is there?
I mean, not our problem,
I
but
thought that they were saying they could get this done by November 30th, but you know what? I think there is somebody from Promise on the call and can
Okay.
speak to that if that's okay with y'all.
yeah, no, that's
So
perfect.
I'm gonna stop sharing so you can see them.
Cause I want to be fair to them too. I don't want it to show up on the 30th and they're like, well, we don't have our meeting till the 12th and we wanted something on the 8th. Okay.
Hello. Hi, it's Jamie Dahlman. I'm the CFO with Promise Healthcare. And I just wanted to talk to that point. We should have it completed by November, at the end of November, but our board meeting isn't until I think because of the holiday schedules, everybody has pushing their board meetings back. So I believe that we're meeting on December 22nd. Does that help? Hello, can you hear me?
Yeah, we can hear you. Yep. Yeah, sorry.
Okay.
Yeah. So then we wouldn't be able to vote then on the 20th. We'd have to be January then. Yeah. I mean,
So if the audit comes and we review it and there are no problems,
yeah.
you don't have to vote on it at all.
Okay.
So we can think that's how it's gonna work out. And if it doesn't work out that way, then I would bring you an action in January
Okay.
or a request, or they would bring you a request. They have some time. If we say, oh, this audit, shows non-compliance, we are terminating the contract. They have the opportunity to appeal that to you at the meeting. So I think this is okay.
Okay.
Yeah.
I just don't want them to give you all the paperwork. I mean, the 22nd is a Friday, so, and then after that's Christmas, so, and then after that's New Year, so yeah, I guess. Okay. We can just do like that Wednesday, the following Wednesday, instead of making it like the deadline for turning it in. It will be January. Our next board meeting will be January 17th after that vote. So
can we say December 31st is their deadline?
I mean, if you don't mind getting it on a Sunday, if they wait till the last minute to send it to you, I don't think they will, but like, I'm just trying to give you more time if there's any issues. That's why I was saying like the Wednesday.
Oh, yeah, I see.
So
27th?
yeah,
Is that
so yeah, the 27th. Just there's some issues. So if there's any issues, you have Wednesday, Thursday, Friday to kind of resolve it. So this way you're not working on the weekend. I know, but I'm just.
We're going to try to
minimize work on the
we're
weekend.
going to try to open that application system on December 22nd.
Oh, okay.
So I'm committing. I'm committing to like a little bit. It's okay.
I mean, I would do December 27th, but if anyone else wants a different date, I'm fine with that too. Because then if there's any issues, then we would be voting on what to do or talking about what to do on January 17th. And I'm of the mind of wanting to approve the motion because, it was something that they were straightforward with us about. They gave us warning about, it was out of their control. So I think, what I want agencies to have good communication with our staff so we can plan ahead, know what's going on, and make sure that we're remedying anything we can. So instead of letting things snowball and get worse. Yeah.
So the motion that's there is not really complete. Like I'm not.
Mm-hmm.
just maybe add all documentation to Wednesday, December 7th.
I mean, you actually.
Yeah, on or before, December 27th.
So it's something like provided. Right. I'm gonna try to follow
Wait.
along.
Motion to waive.
Because whatever y'all say is the motion.
Yeah.
This is just.
And make sure you change the date in the write-up also.
Well, that's just a description. I think whatever you read into the motion is what you all are doing regardless of anything we've written.
Okay.
Okay.
So you would just say provided they provide, I wouldn't say provided, they provide all documents prior to or on December 27th.
So, well, yeah, on or before, but beyond that, so just to be clear, then if we put it that way, what that would mean would be that if they did not, for some reason,
Yeah.
it would automatically cancel. We wouldn't vote on it, it would automatically cancel, correct, Lynn?
Yeah, you would be, I mean, I guess the wording is kind of goofy here. Like what we're
Yeah.
asking is that you don't cancel the contracts as of October 1st.
Right.
That's really all we're asking. That's all the agency was asking. So you're going a little bit beyond that and giving them a deadline for
Mhm.
the audit.
If I see what you're saying, like if we don't, if we say we say that if we're gonna move the cancellation to December 27th, then we're not gonna meet and it's gonna cancel if they don't turn everything in. And then we're gonna have to retroactively fix that on the January meeting.
I'm so sorry. I wasn't really prepared with that.
So we could just move the date of the cancellation from October, whatever, to December 27th in the motion. So.
But I think what Matt is saying is, if we're doing that, which I thought that's what we're doing, if they don't turn in all the documents and the audit, then it'll automatically get canceled and we won't have a meeting before then. I guess the December 20th at the one, unless they say that it's not going to be
Right.
in on time, that would be the only kind of thing we could preemptively say. Like I'd hope they would give us communication like, hey, we don't think we're going to get the audit in the next 2 days.
Mm-hmm.
That's the only thing I guess would be the saving grace there. But I know I haven't run into this situation before, so
Sorry, I'm sorry I wasn't more prepared. I'm just a little bit tapped out right now.
yeah, it's okay. I mean, I guess the
do
only thing would be to move it to like January 18th, I guess, then. And this way, then we have more of a deadline. Or we have another meeting before the January 17th. But I feel like,
Well, it's more that when the documents are due, but then when it's that fact that it's an automatic contract cancellation. That's the thing.
Yeah.
So therefore, if it's an automatic contract cancellation, if they don't meet that, it automatically
it's
cancel.
canceled. Yeah.
So it's just how do we word that to?
Because as it's worded now, you're just waiving all
Yeah.
automatic cancellations, and that's not very useful.
So you want to you're trying to build a little better container than what we've proposed. Okay.
That both holds them accountable, but also doesn't like. Oh, I was going to say open the floodgate. That doesn't put them into a bad situation.
Yeah.
So then you don't want to waive. You could say motion to delay the automatic cancellation and use it to December 27 unless the approved audit has been submitted and is acceptable. I don't know what I just said.
The key word is delay.
Yeah.
We got that.
So it'd be like motion to delay automatic contract cancellation of the contracts, yada, yada, yada. If until December 27th, provided all documentation is provided prior to that, provided prior or on that date.
But again, that goes to the same thing that if there's
I
some delay,
know.
so.
Yeah, I mean, I guess the question is, are we okay? with
Yeah,
having
that's the thing, are we-
having a 2-day deadline, like a 2-day gap between like our meeting on the 20th and their meeting on the 22nd? Because like the audit will be in at the end of November, so they should know.
Yeah.
And so on our December 20th meeting, we will know that the audit is done. They just have to vote on it. Like they should tell us that the audit has been completed at the end of November.
Yeah, that
And
makes sense.
so I think I'm fine with keeping it as the
Mhm.
27th because it's just
Yep.
their meeting. It's more of a procedural thing instead of a actual, like, do you have the documents? Like, yes, it's either yes or no. We have it at the end of November. So I don't think that is an issue because the document, an audit should be done. Their board just has to meet and vote to approve it and send it to us, but they should be able to tell you before our meeting on the December 20th that the audit has been completed and it is turned in and that we're just waiting for the board to vote on it.
Could
So
we,
I'm okay.
oh, sorry.
John to make a motion or should I bring this to someone else to look at? See if I can't.
The simplest way to say it is motion to delay the automatic contract cancellation until December 27th, period. Because you don't need to put requirements in.
Mhm.
What you're doing is
Yeah.
moving the date.
I wrote it down. I wrote what she said. I mean, what she said.
All right. Do you want to do the honors? Yeah.
All right. I move to waive the automatic contract cancellation of CCMHB contracts with Promise Healthcare for mental health services, MHB 24-013, and PHC Wellness, MHB 24041, until December 27th, 2023.
Elaine, you said waive instead of delay.
Oh, that's because that's what's written there. I move to delay the automatic contract cancellations of what I just said until December 27th, 2023.
Second.
Thank you.
So for this one, since it does have some monetary, we
As
have
it
to
is-
do a roll call.
As it
All
will
right.
be written.
Can I get a roll call, please?
Daphne Maurer,
Yes.
Lisa Liggins Chambers, Molly McClay,
Yes.
Yes.
Elaine Palencia,
Yes.
Jen Straub, Jane Sprandel,
Yes.
John Paul Youakim.
Yes. All right.
I wasn't asked, but yes.
Oh, man.
Sorry, Matt Hausman.
Yes.
Sorry about that.
All right. Good teamwork, guys. Good teamwork. So with that, we'll move on to the revised 2024 budgets.
Yes, you have to vote on this too, and I haven't looked at it in a long time, so hopefully I know what we did.
There a difference in the amount allocated because the taxes was different than we expected.
I think you're right. There was revisions for considerations. The property tax was projected to increase by a lesser amount than we thought. And we talked about it a long time ago. So your allocation, like everything was safe because we knew this was happening. So So you're right, property tax revenue is lower than you had originally approved. Interest income was recalculated, and I think it was quite a bit higher. Back taxes were recalculated also higher. But the total, so those total adjustments to revenue still resulted in total revenues lower than originally planned. So some of the expenses had to be reduced also to compensate. But then on top of that, a bunch of expenses are changed with new information from the county, which were health insurance costs were quite a bit higher. So we couldn't cut from that. I think we tried everything not to cut from contributions and grants, which is where you put the agency allocations, but we might have had to do a little of that. But then on top of that, there were a bunch of changes of category because the auditor's office is moving toward perfection, which that's great, but it's just on the ground, it's a little, it's kind of time consuming for Chris Wilson and then for me too. And so some of the changes in these budget presentations are just changes of category and not, basically we kind of do the same thing from one year to the next. We don't have a lot of unexpected we don't need trucks, to be replaced every 3 years. And we don't, for the most part, we don't need a lot of new equipment, though that has happened and it could again. So anyway, it's mostly steady, but I think that's right. Thank you. Okay.
And so below you see on the bottom page 128 is just the motion to approve the revised draft budget. Is there any questions or comments that people had before we make a motion for this? All right. With no discussion, I'll move for a motion to approve the attached revised draft 2024 CCMHB budget with anticipated revenues and expenditures of $6,837,875. Is there a second?
I'll second.
Any discussion? All right, can I have a roll call, please?
I think I got it this time. Lisa Liggins Chambers, Molly McClay,
Yes.
Joe Omo Osagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub, Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
and John Paul Joachim.
Yes. All right. Thanks, Leon. With that, we'll move on to the evaluation capacity building project.
Hello, everyone. Good evening. I'm Jacinda Darius. How's everyone doing this evening?
Doing well, staying healthy.
We're good.
That's great. So I'm going to give a brief update on the evaluation activities. The major activity in the last month since I presented last is that we have conducted a pre-survey for our group level assessment. And as a reminder, the group level assessment is a strategy of collecting data and analyzing data that centers staff or whomever are participating. And so the goals of this group level assessment is really to find out from agency staff who are currently involved in evaluation activities or who will in the near future be involved with the evaluation activities, to understand from them what their needs are, what the challenges have been, what has worked well, and what can be modified as we move forward. including helping us to identify the types of trainings that would be most beneficial for agencies, including the micro learnings that we suggested that we would develop, as well as helping us to identify those agencies that would be most likely to benefit from the one-on-one intensive technical assistance. So we're happy to report that we sent the survey to over 40 agency leaders and also staff who were recommended by those leaders. And we have over 20 who have completed it. And that's actually a really good number because those who have been nominated were a second set that we recently sent the survey to. So we will we've asked for them to complete the survey by the end of this week. And it looks like we are narrowing down on a date for this group level assessment, which would be the first week of November is what we're hoping for. And it looks like a lot of people are available at that time. And we are happy to report too that the survey has a broad range of people who have completed it in terms of a wide variety of agencies that are represented, from directors to program coordinators to therapists to coaches. So a lot of different staff who are involved in the evaluation activities, as well as a wide range of years in the agencies, from those who have been there for less than a year up to over 20 years. About a mean years of in the agencies about 10 years. And so we're waiting for a couple of more people to respond to the survey so we get as much voice as we can. And then we will schedule that group level assessment and we will collect those data and we'll have preliminary information to share hopefully at the next board meeting. So I open it up for questions because I said a lot in a very short period of time.
We might have, it might be a tight turnaround because the next board meeting is like actually November 15.
Oh, sorry. This thing is a little bit later. Okay, maybe December. It'll be early winter break, holiday break from the winter weather excitement for you.
Yes, exactly. A great end to the year.
There you go. Thanks for that correction, Lynn. Are there any questions, thoughts, reflections?
So I guess I had a question was, so for the 20 that completed the survey, have you already gone through those and already have some kind of idea of like the challenges and the needs that those staff and other people that fill out the survey have need like that's what kind of needs they have to serve the community they're serving?
So we didn't ask about all the challenges of so forth in the survey because that's what the group level assessment is going to give us. And we find that if we ask that in a survey, we're less likely to get results and open-ended comments. We have asked them, what do they want to discuss during the group level assessment, including the challenges and weaknesses and so forth that they may have experienced. And so those are helping us identify what the prompts are going to be during that data collection, which I guess you can consider those prompts sort of as like questions or things that to have them think about and provide data on. And so from that larger group of individuals who can then freely respond during that time period, we're going to get a lot more data than you would get from a survey, which is why we're doing it this other way. And also that they will be able to interpret what the data they're generating. So it's not us sitting and saying, okay, we think we understand what this challenge might be, but actually those who participate in the GLA will not just generate the data, but also interpret it and then assess what the priority areas will be. And then also some action items that they would like to see occur. And then we will make those action items that are feasible and that are prioritized actually happen. Is that helpful?
Yeah, very helpful. Thank you so much.
Great. Anything else?
All right. Well, thank you so much, Jacinda.
Absolutely. Well, have a wonderful night, everyone.
Thank you, you too. I'll see you next month.
Yes.
All right. With that, we'll go on to the expo update. Coming up soon. Mhm. So I guess I'll start with asking just a question about the expo. How is the fundraising going for that?
Do you want to do that?
Sure. And then you can like speak if I misspeak, you can correct me. A big challenge that they have encountered this year is some of their larger sponsors have chosen to sponsor at a lower rate or maybe not at all. I personally reached out to a couple like potential new sponsors and they too are like, oh, well, we've got this and that going on, so we're going to pass this year. Early on in this, I reminded, especially our coordinators, because I think they take this so to heart. And I tried to remind them, do not take it personal. Every home, every business, everyone is strapped right now. And so I do feel like some of those major donors are down. It seems like a lot of our exhibitors are maybe more not-for-profit type, so they're like not paying as large of a fee to be there. And again, that's not all bad because those are the places, you know, our citizens are going to use versus maybe a big, you know, wealthy empire, you know. So, to answer it, yes, I think it's down, but I don't think we're going to like be in the red where we're like, oh my gosh, what did we do? Because I think they made some cuts like on marketing. We did a few different things. You know, you gotta change it up. And I think they saw some things we could change. So.
I mean, there's really a shift in strategies this year. Like, I mean, kind of just, it worked fine a certain way for 12 years. And then now everything's different. And so we've had Barb Bresner, who was the coordinator for years and years, going around and Jane Sprandel as well, setting up a booth at other community events to talk about all the resources available through the expo and on the website and in the book. And so that's just like, that's been our main marketing strategy, right? Like we're still buying ads here and there, but it's not clear who reads newspapers or how good the social media reach is really. So it's been different, but we heard something encouraging this morning from Becca Obachowski, who's the co-coordinator of volunteers. I don't know if Ms. Chandra is still available or would be comfortable to speak to that, but Becca was saying most, you know, like the different gaps in the volunteer sign up every year. And this year the gap is greeters at the doors. So, you know, she's not feeling as discouraged as our coordinators are. And thank you, Jane, for, you know.
Well, and I spoke with Lynn the other day and she had sent an email and said, well, I didn't officially, you know, put in a thing on the volunteer sheet, but, you know, I'll be there all day. And I said that I actually did put in a small time, but I will be there majority of the day. And so, but what I was very pleased to see was a lot of shifts were full. The shifts of like setting up and tearing down and bringing stuff to the mall. People stepped up. I know that John's going to help, you know, with the cleanup and taking stuff back. And to me, those are some of the most important shifts because after you've worked the event all day, you really don't want to haul tables or whatever. So, so I was pleasantly surprised that, you know, it looked like we'd had a lot of volunteers. And so I don't know exactly who gets all the kudos on that. I think it was a group effort. So, and I'm sure there is still room if you would like to volunteer.
You know, the one thing I don't see on here is two of our biggest employers in town, like Kraft and U of I. I don't know if anyone's reached out to those groups to see if they want to, donate and be sponsors for something like this. Because I feel like there's a lot of people that, are probably employees and students that would appreciate utilizing this expo, but
Even if you contact the College of Applied Health Sciences or the College's School of Social Work, could be. The Chancellor's office really is trying to do a lot of work with the community. So those are three possible places.
We've had, the university has been involved from the beginning with this, but their engagement is less and less every year. Dres has always had a seat at the table, but I'm not sure. I don't think there are big sponsorships of dollar amounts, but I think what you're saying is the people part. And I think that's what I'd rather see too. The money would be great, but the involvement of people in those schools would be even better. I think it'd be good for all of us. But yeah, I think the university is always challenged to truly connect with the community. And it's things like we have a meeting and say, yeah, let's connect. And then their secretary calls and, it's kind of like, but we were just talking in the parking lot. Yeah. So.
And I know of late, the Chancellor's office has insisted that they would like to help a lot more. So I mean,
yeah,
putting a bug out there, at least I know it's 2 weeks. So it's, but
Yeah, I think in addition to those colleges at the university and the chancellor's office, I think a very well-resourced department at the university is athletics. And if some student athletes came out and there was like Illinois merch or something, I don't know, maybe that could be a draw for.
Kind of talking about Illinois athletics. I don't know. 2 months ago, I had this brainy idea of, we're the University of Illinois. We have the wheelchair basketball team. Why are they not there? And it really came down to they were concerned about liability. Because that opens up a whole thing. Like if they're demonstrating some skills in one of the wings of the mall, that could become a liability issue. And so to my knowledge, they were not approached about, would you want to do this? But I was just like, I was all excited, the Abilities Expo does it in Chicago. That's what gave me the idea, and it was just kind of decided it's probably a liability issue. So we probably should not. But maybe that's something that we, again, kind of put it on the potential for next year. Maybe we ask around, do you have any protection, on your end? But then we might have to get with the board lawyer and things like that. And if it gets out of hand, then we, nix the idea. But I think that would be a great resource in our community. Because for one, I don't go to enough of the things on the University of Illinois campus that are a couple of dollars. I mean, or free. I think there's some athletic events and things that are free. So.
I guess the important question is, are people going to dress up and is there going to be candy at this event? I think we do need some clarity, because, after, walking around all day, I think, people are going to want to, take a little sugar high to keep going,
I think if you're on the cleanup crew after the event is over, there is no question that you can wear whatever you want. No one needs to, but I think they're advertising it as for folks attending to, please wear costumes. Oh, Jane knows something.
Well, no. They're encouraging people to dress up and, this is a family event. And so of course, because I'm always the negative Nelly, I'm like, ooh, I hope we don't have people dressing up not appropriately or scary. So I don't know who gets to handle that, but See, remember what you said about me, how I think like, okay. See, I always think of the things no one else thinks of, but are we gonna have some folks dress up like whatever? Or are we gonna have like scary masks and stuff like that? I hope not.
So I'll leave my purge mask at home and my Chucky doll. Yeah. So I guess it'll just be Pokemon and superheroes.
Lynn and I will probably go up to a lady and be like, excuse me, your costume. And I'm like, what? This is my apparel to shop at the mall.
Any other questions or comments? I think the nice thing is, it's going to be indoors, so no matter what the weather is, it'll be fun. So I'm excited. All right. With no other comments, we'll go on to agency input. Thanks, Jane. For this section, I'll reserve the authority to limit individual agency representative participation to 5 minutes, and then keep the total time to 20 minutes for the whole session. If there's any agencies present that would like to make comments, now is the time. Just raise your hand and we'll have Lynn unmute you. All right. Okay. Seeing none, we'll move on to board reports.
So I attended my first time attending was the University of Illinois Student Mental Health Community of Practice meeting. This is a meeting that occurs with a lot of campus partners and some community partners bi-monthly at the university. So this was on October 2nd. And at this meeting, I was mostly just kind of getting my feet wet, understanding kind of what this committee does. But there was a presentation from the Office of Threat Assessment, which is a new office at the university that's really focused on reaching out to students and being proactive about students who may have mental health concerns or other kinds of concerns. So the leader of that office gave a presentation, and there was also some discussion of a few other things. There is a new law called the Mental Health Early Action on Campus Act, and the university is working to implement various facets of this law, including doing mental health first aid training with a number of, I think, like resident advisors, academic advisors. A lot of different university staff are working on that right now. And there was also a discussion about crisis response across units at the university and beyond. And one thing that did get mentioned is that some of the mental health units at the university have had a little bit of difficulty getting information when students are assessed at community organizations, such as the two local hospitals. I know there's a member of Rosecrans on this committee, but they weren't in attendance that day. But there was a discussion about potentially the mental health units on campus kind of re-evaluating or discussing the contracts with the community mental health services to make sure there is a good coordination of care between the campus and the community when it comes to students who are in mental health crisis. So it's a very interesting committee to be a part of and just kind of learn about what the campus is doing and kind of how they partner with various agencies in the community as well.
Thanks for that, Molly. Are there any other board reports? Yeah, you can ask something.
When do they meet again?
So if this I've been having some issues with the Outlook event like staying on my calendar. I believe it's the first Monday in December. Okay. And I know that So Lynn and I kind of share membership on this committee, and they want us to give a presentation about the mental health board at the next meeting.
I feel like you tuned me into that before. So, okay. Yes. Got it. It's on my calendar. Yay, us.
All right. Any other board reports? Seeing none, we'll go on to county board input, which we won't have because Jen's not here, unless you know anything, Lynn. All right. With that, we'll go on to the Champaign County Developmental Disabilities Board input.
They met this morning and had, similar items. It was a really good discussion. I think we have some members of the board and I have become involved with something called the Going Home Coalition. There are lots of small advocacy groups in Illinois who are really pushing for more community-based DD care and less institutional care. And so they're all finding that each of them are too small to advocate effectively. So they're starting to meet all together. This was a meeting with the attorneys from Equip for Equality who are trying to get the Department of Justice, the U.S. Department of Justice, to come to Illinois to investigate the deaths and the maltreatment at the institutions here to push Illinois over the hump. There's an issue that I think that we have to address, and that is people in Illinois don't have enough experience with really good community-based care to have confidence in it. So a lot of people are hanging on to the institutional model because it's what they know. So, I think that we have to do a better job in the community-based space, or it's just another lawsuit spending lots of money and resulting in no change. So anyway, that was an interesting discussion, and they had a lot of suggestions for the 3-year plan, some language improvements that might be valuable to you all as well. So anyway, that's what they did today. And I feel like there was other good stuff, but just trust me, it was good. Okay.
All right, with that, we'll move on to board announcements and input.
I wanted to mention and I guess give great kudos to the Up Center. Pride Fest I thought was really good this year. This is, I think, the second year I've attended. As my daughters like to tell me, I've grown a lot. But at one point, I hope I don't get like teary-eyed now, but at the end of the day, after the parade and so that, I reflected on how many counseling groups were there, how many churches were there. And it was such a nice feeling to me to feel that we are in a community that is trying the best to understand, accept, respect. This year they did have, and I can't remember what they call, like safety patrol or something. They'd had some threats. They were afraid there would be some problems. There were a few people in extra vests and things like that. Overall, I think, from what I could tell, it was a very good event. I will say, my daughter and one of her very best friends, we did have a situation that I had to go and get some assistance because I was afraid it was going to come to blows. A gentleman was using some pretty nasty terms towards my daughter, her friend, and then this young man. So I was really proud to be part of the community. Most of you know I work for General Mills, and we can get a free t-shirt for Pride Month. And so I got it and I wore it and I posted it on our, we're a huge worldwide company. And I got a lot of credit for, representing the company, and things like that. And I thought that was nice. And I have a really nice picture for you. Those of you who are Facebook friends with me, I have a picture of the MTD bus that has all of us are welcome or whatever their little slogan is there, and the county courthouse. And I was like, this is Champaign-Urbana. And I want them to look at our community as we are supporting and encompassing. So like I said, kudos to the Up Center and everybody else who had a part of that, because it's hard to change a lot of people's minds. So.
Thank you so much. We so appreciate it. Like we couldn't be here without all of you. So thank you.
All right, with that, yeah, so I will recuse myself for the other business, and hand it off to Molly to take over. See you guys next month.
Well, do we have to do that do we have to move to executive session, or can we just make the motion and?
If you want to move to a closed session to discuss the closed session minutes, we can do it. I brought a second computer in order to record that. It would result in another set of closed session minutes to review every 6 months. I mean, but you could, and I think I shared that I would like to have a closed session on this matter eventually.
Oh.
If there are updates, but there's no updates anyway. John's not listening. Okay.
So in other words, can't we?
So we can just, you all can do the business if you don't want to move into closed session. Okay.
Yeah, that's what, so
You
I'll
ready
go
to
ahead and move to
state the
Oh.
dates of the minutes out loud.
Yes.
I guess I'll say, so there's been a request to consider maintaining as closed the minutes of closed sessions held on February 19th, 2020 and February 26th, 2020, which have been distributed to board members. If anyone needs to discuss, we can entertain a motion to move to executive session. If that is not needed, then I will entertain a motion to accept the closed session minutes as presented and continue maintaining them as closed.
I'll go ahead and move to accept the closed session minutes as presented and to continue maintaining them as closed.
Could I get a second?
I will second that.
All right. With that, now I have to remember how to do a voice vote. Do we need discussion?
It's no money and no personnel. I don't think you
Okay.
I mean, to be safe, let's do a roll call.
Yeah, I'd like to request a roll call.
Thank you, Rita.
Alrighty. Molly McClay,
Yes.
Joe Omo Osagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub, Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Lisa Liggins Chambers, and John Paul Uicky.
Abstain.
Thank you, everyone. I guess since I'm still in charge, I will adjourn this meeting.
Thank you, everybody on the Zoom too. Good to see you all.